Leader of the third party.
Monsieur le Président, les Néo-brunswickois s'attendent à être soignés quand ils vont à l'urgence. C'est un service de base. J'ai dit maintes fois dans cette chambre que les longs temps d'attente pour recevoir des soins dans nos salles d'urgence mettent le public en danger. Nous en voyons maintenant les conséquences. Le samedi 24 février, l'hôpital de Moncton a fermé pendant 8 heures la section de son urgence destinée aux cas non injoues et l'a fermé aux ambulances pendant 2 heures parce qu'il n'y avait pas de personnel infirmier. Les failles de notre système de santé s'aggravent. Encore une fois, je demande ce que le ministre fait pour veiller à ce que nos hôpitaux aient assez d'infirmières et infirmières pour occuper les postes de leur service des urgences.
Recognizing Honourable Minister of Health.
Merci beaucoup, Monsieur le Président. Écoutez, il est évident, ça me permet aussi de reconnaître le travail fantastique que font tout le personnel dans les services d'urgence ici, dans nos hôpitaux de la province. Merci à tout le bon service qu'ils font. Et puis oui, nous sommes au courant qu'effectivement, il peut y avoir, comme tout système, encore une fois, il peut y avoir des manquements. Ça arrive, ça va continuer d'arriver parce que la perfection n'est pas de ce monde, Monsieur le Président. Et puis nous en sommes conscients et toujours, comme notre gouvernement le fait avec la croissance et le développement économique, nous allons toujours continuer à chercher à améliorer le système. Et l'exemple qui a été donné par rapport à l'hôpital de Moncton, je peux dire qu'il y a eu énormément de collaboration qui a été faite avec l'hôpital Georges-L-Dumont pour que les patients soient traités de très haut niveau, de très haute qualité. Et je peux vous assurer que le service a été maintenu et nous allons continuer à faire de la sorte. Merci.
Leader of the third party.
Mr. Speaker, Fredericton's ER has experienced a 25% increase in urgent cases this year compared to the same time period last year. The first 2 months of 2018 have been the busiest for the hospital it's ever seen. They've been over capacity every single minute of 2018. Long wait times put patient safety at risk. As I've said time and time again, Mr. Speaker, huge cracks are opening up in New Brunswick's healthcare system, and this government seems oblivious to the fact. When emergency services are not available when you need them, it says to me that this government has its priorities screwed up. What is the minister going to do to ensure emergency services are there when we need them?
Recognizing Minister of Health.
Thank you very much, Mr. Speaker. Well, I mean, I appreciate the member opposite talking about what happens here in Fredericton because, yes, we are continuously working to improve the system, not only all across the province, but specifically here in the Fredericton area. We're doing massive investments at the Dr. Everett Chalmers Hospital here in the capital city. We've worked also with the downtown health clinic as well, which we've opened. Those are all things that help with wait time, Mr. Speaker. And not only that, this is the same member that was criticizing the partnership with Medavie and our deal. Well, guess what, Mr. Speaker? That will have more people get treatment at home. When you get better treatment at home, you go less to the emergency room. You go less to the emergency room, you'll get less problems there. So all of those things we're doing, we're helping to reduce wait times in the hospitals. Thank you, Mr. Speaker.
Leader of the third party.
Mr. Speaker, I don't know why the minister refuses to acknowledge that we have a nursing shortage in this province. In fact, nursing graduates from New Brunswick are being snapped up by Nova Scotia because they can't find full-time work in New Brunswick. How is that even possible? I have a constituent, Mr. Speaker, who was on the Dean's list from UNB's Faculty of Nursing. She couldn't find a nursing job that provided full-time work here in New Brunswick, but was immediately hired in Halifax after graduation. And the minister wonders why we can't recruit nurses from outside the province. We can't even hold on to the nurses that are graduating inside the province. We've got, Mr. Speaker, a crisis emerging here. Our ERs are clogged. Sick people are placed in the hallways of nursing units where there's no oxygen supply, there's no suction in the walls to help them if they need that, Mr. Speaker. And when a nurse calls in sick, there's no one to replace them. So, the question is, when is the minister going to create full-time nursing positions to address this widening crack in our healthcare system?
The Honourable the Premier.
Mr. Speaker, one thing that won't help the wait times is all the fear-mongering coming from the members opposite. What will help reduce wait times and address and ensure that we're strengthening the quality of healthcare and the accessibility of healthcare in this province are some of the following things. Investing more in healthcare. We are the government that has invested the most in healthcare in the history of our province. Investing in the infrastructure of our healthcare system, like the hundreds of millions of dollars that we're going to be investing at the DEC, at the St. John Regional Hospital, the Moncton Hospital, the Georges Dumas Hospital, the Bathurst Hospital, the Edmonton Regional Hospital, the Perth Andover Hospital, the Miramichi Hospital, the Charlotte County Hospital, and we can keep going. The Fredericton Community Centre here, which I think the member opposite would be well aware of. The midwives program that we started here in Fredericton to increase accessibility to reproductive health, Mr. Speaker, advanced care paramedics, nurse practitioners, hiring more doctors, hiring more specialists, having more nursing homes, getting seniors out of the hospital beds when they don't need to be there and into the right type of care. That's what's going to...